So welcome everyone to our second SASGOG researcher interview. I'm so excited and have the pleasure today to introduce Kristen Matteson, who's going to be talking with us today as a successful SASGOG researcher and academic OBGYN. Welcome.
Thanks for having me.
Well, great. Well, let's just jump right in. Well, can you first just introduce yourself and tell us a little bit about where you're from and where you're at currently in your position?
Excellent. So I'm so happy to be here. I appreciate the invitation to talk about research in women's health. So as Caitlin already mentioned, my name is Kristen Matteson, and I'm an academic specialist in general obstetrics and gynecology here at Women and Infants Hospital in Warren Alpert Medical School at Brown University in Providence, Rhode Island. I'm originally from southeastern Massachusetts and traveled all the way down to Pennsylvania for college, but have slowly been working my way back to the Northeast to be near my friends and family. I did my medical school training at Tufts University School of Medicine in Boston, and then my residency training out in Springfield, Massachusetts at Bay State Medical Center. And then following residency, I came here to Women and Infants in Brown to do a T32 fellowship in clinical research training and get my master's in public health at Brown University. And I've been here ever since.
Well, great. That sounds like a journey right there, but a lot in the Northeast, I see. I see that you like it up there.
Yeah, it's nice to be near family and friends.
And so the next question is, just tell us a little bit more about your research, what your research interests are, and what you're currently working on.
Yeah, so currently I have both roles doing actual research and then administrative functions related to research. So I serve as the vice chair for research for the Department of Obstetrics and Gynecology. So working on helping all faculty in the department get to their research goals by improving the policies, the processes, and our support mechanisms so that all individuals interested in research can successfully get their research off the ground and executed. In terms of my personal research, I'm super excited to say that we're finalizing our manuscript from the Stopping Heavy Periods project. So Stopping Heavy Periods project was an R01 funded by the NICHD to compare two treatments for heavy menstrual bleeding, so the levonorgestrel intrauterine system and combined oral contraceptives, at improving bleeding-related quality of life among individuals with heavy menstrual bleeding. And the exciting thing about that project is the primary outcome measure is the menstrual bleeding questionnaire, which I developed as part of my work on K23 many years ago. So super exciting. And then I'm leading a project for the Society for Gynecologic Surgeons systematic review group looking at opioid use after gynecologic surgery, which is, I think, something you and I might have a little bit in common. And then similar to that, I'm collaborating with a health interventionist at Brown, and we just finished some preliminary work focused on pain management and opioid use after cesarean delivery and hysterectomy. And we're looking at taking all of those data that we've been generating and incorporating them into NIH grant proposals for the October 2021 funding cycle.
That all sounds like such exciting work. And I'm really excited to hear more about how you got to this point. I know you mentioned a little bit about your T32 training and a K23. I know we were just talking before this interview started because I was a recent recipient of a K23 also from the NIH. And so can you just tell us a little bit more about, maybe for our listeners who don't know a lot about the T32 and K23 funding mechanisms, and maybe a little more about that and how that helped you on your journey to become the researcher that you are today?
So I love talking about it because honestly, when I started as a T32 fellow here at Brown, I had no idea of the alphabet soup of all the different funding mechanisms at the NIH. So T's, K's, R's, U's, I had no idea what they were. So I'm happy to explain that to the listeners and the viewers of this interview. So a T32 is a funding mechanism for individuals who are within fellowship training. So it's individuals who haven't totally completed their training, so it's a research fellow. There aren't a lot of T32s for OBGYNs across the country. They were more prevalent about 15 years ago, but there's less of those mechanisms. So it was like a fellowship. So it was like I was a PGY5 and a PGY6 doing a research fellowship and getting my master's of public health at Brown. The K mechanisms, there's a couple of different types, and I failed to mention that before my K23, I was actually a K12 scholar funded by the Women's Reproductive Health Research Program, which is a K12. The number after it denotes whether or not it's owned by the institution or the individual. So a K-12 is a funding mechanism that an institution has, and they can have faculty apply to be those sorts of scholars at their own institution. So if that faculty member leaves and goes somewhere else, they can't take that with them. So it's an institution held training program. And then a K-23 is granted to an individual. So an individual independently applies for that mechanism, and they are personally funded, and but it's not tied to the institution. Both of those mechanisms are super helpful for career development for individuals who want to be independently funded, because they protect at least 75% of the individual's time for both research and career development. So we finish our medical school training and our residency programs in obstetrics and gynecology, and most programs work hard to get residents the basic training they need to be good interpreters of the medical literature and be able to start some research on their own. But to develop some of the sophisticated skill sets you need to be an independently funded investigator, often a lot of more time is needed to develop those skill sets. And that's where the K mechanism can be helpful. And then the R's, of course, are independent awards to fund individual projects proposed by investigators. So I think that gives it in a nutshell.
Mm-hmm. No, thank you so much. As definitely your faculty development side is coming out here. I find that probably all of the people that you help mentor are very appreciative of all the information that you give for people that are working to try to integrate research into their careers in OBGYN. So thank you for that. In addition to those funding mechanisms, which are very important, I don't want listeners to get overwhelmed by, again, that alphabet soup, because it can be very overwhelming to hear all these numbers and letters and how those can help people along the way. But it sounds like what you're saying, the big take-home message is at your institution and also from the NIH and other funding from external sources, take advantage of these opportunities, take advantage of the funding that is out there. That sounds like that's what I'm hearing from you.
Absolutely. And then it's not the only way to do it too. I mean, it's the way that I did it because those were the opportunities that were available to me here. But other things individuals can do is working with your division director or your department chair to protect your time and get an investment in your research development and education. Many academic medical centers and OBGYN departments have some sort of affiliation with schools of public health or with universities, and investing in our junior faculty members becoming independent investigators in women's health research it's a great investment. So talking with a chair, because the keys of the K were time and funding for career development, and a K isn't the only way to get it. It might be that you've done some great research and you've shown promise in your area, and you work with your chair of your department to get some sort of investment for a few years, and you're in protected time for research development and career development activities.
That's great advice. So and you've given us some examples of some things that really help promote your trajectory as a researcher in academic OBGYN. Can you tell us a little bit more about some challenges that you've encountered on this journey, either through training or recently in your recent years as a researcher?
I mean, I think one of the challenges is funding. Is that, I think that the funding and pay line at the NICHD is an extreme challenge, and that's where a lot of the work for OBGYNs goes to, looking at women's health. I think it's great when people are focusing on different areas where they can look at different areas of funding and different opportunities, but I think that's a clear challenge. I think one of my personal challenges is that I didn't choose research because I didn't love clinical care and I didn't love education. I love both of those parts of my job a ton too. And so it's really hard to pull back from that enough in order to focus on research, because it does clinical care. I still love being in a room with a patient one-on-one and talk about helping them achieve their goals and optimizing their health and quality of life. And it's a hard thing to kind of step back from. The other thing that I think is challenging as you get more senior in your own department or your own division is that I think, I can only speak for myself, but I think one of the reasons I was drawn to research is that I like to organize things and generate clear and effective processes to achieve a desired result. And that's also a skill set that's really helpful in administration. And I think taking on different administrative roles, it's really hard to balance research and administrative work. So that is a personal challenge for me, and something that I would urge people to really think about administrative work and how it can potentially detract from you getting to your research goals.
Mm-hmm. Again, really good advice. And I think you hint on, as academic specialists in OBGYN, we generally like a lot of things. That's why we are specialists in general OBGYN, right? Is that we like obstetrics, we like gynecology, we like different areas. And so that type of, I like everything and I want to be involved in many things can translate into the different buckets, right? The clinical, the research, and the administrative work too. So it's good to make sure you kind of check ourselves and our really excitement that we can have that to help women and to help our patients can lead to sometimes taking on things that are a little too much and interfere with the other bucket.
Absolutely.
And tell us a little more about what are some other areas in your training and through your trajectory that have really promoted your ability to integrate research into your clinical care, into those administrative duties? And maybe if you can give a couple specific examples, that would be really helpful.
No, absolutely. I think one of the things that's been incredibly helpful is generating a specific skill set related to research. So a couple of different areas that I've generated is research specific skills rather than content specific skills have helped me become a collaborator for others on their projects. So one thing is, as part of my K23, I worked to go to different coursework to develop expertise on survey design and questionnaire design methods. So how do you actually ask questions to get the right answer, right? So it seems like you would just write your question and you'd ask your question and that answer is the answer, but there's an entire science behind how you craft the question, how you craft the response options, how you lay it out either on paper or actually I did some coursework for online survey design. So how do you generate it to try to get the answer that's right and not an answer that's just a reflection of the way you design the questionnaire. So that's a skill set I developed that I can then work with anybody asking any question about anything because it's translatable to multiple different areas. So I think that's one area that I've been successful in and it's super fun. The other thing, and I just actually spoke to our residents about this, is that learning how to do systematic reviews, it can be incredibly helpful. So one of the things that helped me become an expert on patient-reported outcome measures related to heavy menstrual bleeding is I did a systematic review of all the patient-reported outcome measures that were out there for abnormal uterine bleeding. So it got me recognized as an expert in the area. And then the other thing is, if I want to write something about patient-reported outcome measures, I know every single one of those references by heart because I lived in that literature for a while. So there's lots of ways to get expertise in that because multiple different medical centers have either like Brown has an evidence-based practice center that you can work with, and then different professional societies have different coursework or organizations where they're generating systematic reviews and putting out clinical practice guidelines. So developing that skill set can help you apply it to your content area and then get you recognized an expert in that area pretty quickly. So those are a couple of things that I think I did that have helped me along the way.
Mm-hmm. You're really motivating me. I'm thinking of all these new ideas for my area too, where I can
work. Endless opportunity, I guess that, and I think, when I talk about one of the challenges, I think one of the challenges is that there are endless opportunities and it's yes. How do you pick which opportunity you're going to seize at any given time?
Yes, definitely. Well, as we close, if you want to, I just want to ask if there's any more pieces of advice or pearls that you would give to our listeners, just thinking about listeners that are going to be along all different areas, right, of interest in integrating research into their practice, as well as levels of training too. So people from more junior to more senior, and any other pearls of advice that you have for our listeners who are interested potentially on seeing how they can get involved in research as an academic specialist in OBGYN.
I think the biggest piece of advice I can give, or the biggest, I guess the thing that's most relevant to me when we think about this is that, women's healthcare hasn't been invested in for years and years and years. So our patients and the individuals that we take care of deserve evidence-based healthcare. And academic specialists in general, OBGYN, are at the core of that healthcare. So we're also the individuals who are best positioned to ask and answer relevant questions that can impact a large population of individuals, right? So it's not the rare things that we're seeing, but the thing you see in the office day in and day out that you realize there isn't a great evidence base, or there's conflicting data, or I think we might be able to meet the goals of our patients better. And so we're at the heart of that, and we can translate what thousands and thousands of general OBGYNs in private practice across the country are seeing in their practice day in and day out into research that generates the better evidence that helps us better take care of patients. So I think it's super exciting to be an academic specialist in general OBGYN who has an interest in developing a research career or developing a research question or getting involved in research, because we're in a great position to really make a major impact on things that matter most in the day-to-day lives of women. So that's what I'd like to say. I'm thrilled for anybody who wants to do research, because I think it's a rewarding thing to do personally, but then I think it ultimately benefits our patients, which is the real thing we're trying to do.
I 100% agree with everything you just said. And again, very motivating and a great illustration, I would say too, of the true overlap between clinical care and research, and that translation that kind of is a back and forth direction, right? And how we can, as academic specialists, taking care of women throughout the life course, really can play a very significant role in that translation between clinical care and research that's going to be best suited for our patients and for their health long term.
Absolutely.
Well, Dr. Matteson, thank you so much again for coming for our SASGOG researcher interview today, and I appreciate your time, and we stay tuned for our next interview.
Well, I thank you, Dr. Martin, for the invitation. It was a real pleasure to speak with you this morning.
Thank you.